Dr. Larry Burchett, MD, and welcome to your 5-minute coronavirus weekly update. Along with Drs. Catherine Sadiq and Kathleen Montgomery, MDs, we will give you the facts and evidence that you need to know for coronavirus this week, June 18th, 2020. Let's get started with the case numbers. Let's talk American COVID case numbers. 158,000 new confirmed cases of coronavirus in the United States, bringing our total to 2.1 million, or about a quarter of the 8.2 million cases worldwide, where there's been 446,000 deaths. 120,000 of those deaths have been American. It's the trends that worry me more than the absolute case numbers. For weeks in the United States, the daily case numbers were going down, but now it appears that they're turning the corner and unfortunately going up in the wrong direction. A couple weeks ago, we were looking around 23,000 daily cases, now up to 27,000. Again, starting to go up for the first time in weeks. Many states are leading the way in this unfortunate increase, including California, Florida, and Texas. And let me give you some specific numbers to put this in context. A couple weeks ago in early June, Texas saw daily case numbers around 1,700. Now they're greater than 4,000. Florida similarly was hovering around 1,200. Now that's greater than 3,000. Worrisome with the elderly population there. And California has been on a steady rise, now also above 4,000 daily cases. All of those are records. Other states that I worry about include Arizona, Alabama, South Carolina, all also showing record daily numbers of COVID cases. Internationally, this global pandemic continues to spread rapidly through Asia, Africa, and Latin America, adding 1 million new cases this week to a total of 8 million. 1 million added to the total of 8 million in just a week. Incredible spread. For more statistics and information, we recommend you turn to Johns Hopkins website online. We will continue to follow these case numbers for you. And now to Dr. Montgomery. Doctor?
A major study published on Wednesday in the New England Journal of Medicine gave some weight to the idea that blood type may have an effect on coronavirus susceptibility. Now let's back up for a second and talk about blood types. Everyone's blood is one of 4 types: A, B, AB, or O. Most people in the United States are either A or O. The gene that determines your blood type encodes for an enzyme that attaches a molecule to your red blood cells. If you're type A, you have the enzyme for A. If you're B, you have the enzyme for B. And if you're AB, you have both. Being type O just means you have neither. Previous studies out of China and Columbia University have raised the possibility that blood type may affect coronavirus. They found that people with COVID-19 were less likely to be blood type O than the general population, but this research has not yet been peer-reviewed. The new study is something called a GWAS, or Genome-Wide Association Study, that looked across the entire genetic codes of patients with severe COVID-19 and healthy controls, looking for differences in their genes. The gene that encodes for blood type was found to be highly predictive of respiratory failure. Blood type O is the most protective, with a 35% decreased odds of needing oxygen, and type A was the most at risk. So why would your blood type affect your chances of getting COVID-19? Well, we don't know for sure yet, but there are some possibilities. First, people make antibodies to the blood antigens they don't have. People who are blood type O make the most anti-A antibodies, which have been shown to bind to a protein on the surface of the SARS virus. These antibodies may also protect against the virus that causes COVID-19. Your blood type also plays a role in how quickly your blood clots, and COVID-19 patients are at risk of developing blood clots, so blood type could have an effect through this mechanism. Blood group enzymes also have effects beyond your red blood cells, so your blood type might be effective against coronavirus in a way we just don't know yet. The bottom line is, while more research is still needed, you can probably breathe a little easier if you're blood type O, and should perhaps be more cautious if you're an A. It's important to note that no study has found an association between blood type and death, so it's important to be vigilant with social distancing, hand washing, and wearing a mask, no matter your blood type. Back to you, Doctor.
Thank you, Doctor. Let's talk about treatment for a minute. Preliminary results of a British study show that the steroid dexamethasone may save lives in sick COVID patients. Now, up until this point, studies had either failed to show benefit of steroids or even some showed harm when given to coronavirus patients. Now, in the British study, 2,100 patients, it appeared that the sickest patients, those on a ventilator, their mortality improved by 33%. It's great news for a cheap drug that's $8 compared to remdesivir, which carries a $4,000 to $10,000 price tag. Dexamethasone could be available worldwide to treat coronavirus. Now, at this point, these results are preliminary. We wait for the full study to be revealed, and also we'd like to see these results replicated to really prove that it works. We'll follow this story for you. Thank you for joining us for your weekly coronavirus update. Alongside Dr. Kathleen Montgomery and Kathleen Montgomery, I'm Dr. Larry Burchett. Please share this video and check out the evidence for yourself on averpoint.com. We'll see you next week.